Hello, my name is Annie Swanepoel. I'm a consultant child and adolescent psychiatrist, and I'm delighted to tell you about an audit cycle I have completed. NHS England launched STAMP and STOMP because they wanted to stop the over-medication of people with learning disability and autism. Now, I work in Essex, and there the management of ADHD, which I think you probably all know is characterized by hyperactivity, impulsivity, and inattention, is commissioned to pediatrics, whereas I'm a psychiatrist. So what happened before I started in my job is that when children were sent to CAMS, children with learning disability, who also had challenging behaviors because of ADHD, the previous locum psychiatrists who worked in post could not prescribe ADHD medication because that was commissioned to pediatrics and therefore prescribed antipsychotic medication. Now, this is not in the best interest of the child because antipsychotics do not treat the inattention symptom of ADHD. They do treat the hyperactivity and impulsivity, so they subdue children, but they're still unable to concentrate. And apart from that, antipsychotic monitoring also requires regular blood tests. And that's difficult for children with severe learning disability because they don't understand why they need it and why they're being restrained. The aim of the initial audit was to map out the psychiatric medications, so including the ADHD treatments that children were receiving, and to make sure that children with ADHD were treated appropriately. So when I started in February 2021, I did an audit of the caseload and found that many children with a diagnosis of ADHD were prescribed antipsychotic medication and no ADHD medication. And I aimed to change this by giving talks to pediatricians just to make sure that they were correctly remembering that children with learning disability can also have ADHD and should be treated for it. And then 2 years later, I re-audited to see whether there had been an improvement. And I was pleased to say that there was. So the percentage of my caseload who had a diagnosis of ADHD in 2021 was 47%, and this increased to 69%. And that fits with the published figures in terms of the percentage of children with severe or profound learning disability who have got ADHD. It is very high at around 70%. Now, looking at the percentage of children who had a diagnosis of ADHD and who were on medication treatment for ADHD, in 2021, only half of children were. But in 2023, over 80% of children with ADHD were treated for ADHD. And then what I was most worried about was the percentage of children with a diagnosis of ADHD who were treated with antipsychotics, so not the correct treatment for ADHD. And in 2021, that was 13% of the caseload, and I managed to halve that in 2 years to 6%. So thinking about the lessons learned, we know that ADHD is extremely common in children with severe learning disability and that it can be treated with medication that is specific to ADHD and which does not require blood tests. And I'm very pleased to say that pediatricians across Essex are more inclined to consider, diagnose and treat ADHD. And this has resulted in fewer referrals to our service for challenging behavior because the children's symptoms of hyperactivity, impulsivity, and inattention has reduced. So thinking about the impact, there's been a substantial improvement in the diagnosis and treatment of children with ADHD and reduction of inappropriate antipsychotic medication use. So that was my main aim. I have given a talk to pediatrics, which has been recorded and which is freely available at the sign-up center. I've also published a paper just around stopping inappropriate medication of children and the STOMP initiative, which has been published in the BJ Psych Advances in March this year. And today, this audit was published in the spring newsletter by the Faculty of Intellectual Disability of the Royal College of Psychiatrists. Thank you very much for your attention.